Welcome, everyone. Thank you all so much for making time to join us for this important meeting today. I'm so deeply grateful to the amazing panel who have assembled for this discussion, and equally or more grateful to the amazing Vanessa Johnson, my co-chair as of the co-chair of the FAPP Structural Interventions Working Group. The FAPP Structural Interventions Working Group was created about 2015 as an evolution from a housing working group of the Federal AIDS Policy Partnership. We are focused on non-biomedical factors and issues and policy and advocacy, and welcome each of you to this meeting today. The current plan for our next month's meeting, the June meeting, is with a focus on the Medicaid work requirements that are barreling towards us for implementation on January 1st. It is expected that by June 1st, we will have regulations issued by the Centers for Medicaid and Medicare Services that will let us know how the impacts and potential harms on people living with HIV and those with reasons for HIV prevention may go as a result of Medicaid work requirements. And as soon as we get confirmation from our invited speakers with the date and time, we will announce that through our communications channels. And with that, I will turn it back over to Vanessa with much thanks.
All right. Thank you, Mark. And thank you, everyone, for attending today's session. There's going to be a series of prompts throughout our session today on criminalization, just to get a temperature check on where we are as people and the issue. So I want to say good afternoon, everyone, and welcome. And thank you for joining today's Structural Interventions Work Group's discussion on criminalization and decriminalization. We are approaching today's topic with a clear understanding that criminalization in America is not neutral. It is not new and it is not neutral, as I've said. Across U.S. history, criminal laws and punishment systems have not only been used to respond to harm, but also to control people, communities, labor, movement, sexuality, poverty, substance use, disability, and health conditions. And I'm sure there are some other types of situations I haven't even named. Criminalization has repeatedly been used to decide whose bodies are sterilized, whose bodies are surveyed, whose choices are punished, whose health conditions are stigmatized, and whose communities are treated as threats rather than as people observing or deserving care, dignity, and support. For people living with HIV and other stigmatized health conditions, criminalizations can turn a public health issue into a punishment issue. Instead of expanding access to testing, treatment, health, literacy, housing, harm reduction, and trusted care, criminalization only serves to deepen stigma, increase fear, discourage disclosure, and discourage engagement into systems and reinforce mistrust. Today's conversation asks us to think about criminalization as a structural intervention issue. If laws, policies, and enforcement practices are producing harm, then changing those laws, policies, and practices is part of our work as public health workers and advocates. Decriminalization is not about ignoring harm. It is about refusing to use stigma, fear, outdated silence, racism, ableism, homophobia, transphobia, poverty, or health status as the basis for punishment. We are grateful for today's panelists for helping us understand the history, the current landscape, the advocacy priorities, and the concrete ways in which we can become more involved in this work. So before I bring up the first presenter, I'm going to open up with a prompt for you all to put in chat if you like. I'm sure many of you have already introduced yourselves. If you haven't done so, please take a moment to do that. So, what word or phrase comes to mind when you hear criminalization of health conditions? What word or phrase comes to mind when you hear of criminalization of health conditions? Give you a couple. And Mark, if you could call out a few when I ask you to, that would be great. Hey, so do we have a couple, Mark?
We do.
How about a couple? That'll be great before I introduce Carrie.
Violent,
I see a lot of that. Yeah.
maddening, unscientific, capitalism, stigma and discrimination, insanity, unjust, control,
That sounds really good. Thank you.
fear.
Oh, okay, that's good. We that's, we don't like it, is what I'm hearing. We don't think it's something that should be done at all. So I am so happy. I am grateful for the speakers who are going to be presenting to you today. Our first up is Carrie Thomas, and Carrie will introduce himself to you. He is going to be talking about the impact of HIV criminalization is real. The impact of HIV criminalization is real. And what I want to say about you, Carrie, is that you're going to bring the perspective of helping us understand that criminalization is not abstract. It is a very real. You're going to share your experiences with us. It affects people's freedom, dignity, housing, employment, healthcare access, relationships, mental health, and ability to rebuild lives. His remarks should also help connect us understand decriminalization from a broader perspective, not just of HIV, but one of justice and public health. So without taking any more of your steam, Terry, I am so happy you're with us, and please give us your wisdom. Thank
Yeah,
you.
it's great to be here to see everyone. It's such a powerful group, and hope I can add a little bit to the conversation. As mentioned, I'm Kerry Thomas. I'm with Zero Project as their policy strategist. I'm mainly focusing on narrative strategy and getting the message out of what exactly what this conversation is going to be about, what the dangers and the real life impact to criminalization. So yeah, I'm really anxious for the conversation, not just what I can add to it, but also what everyone else can contribute to the conversation as well.
Thank you. So we had some questions lined up for you.
Yeah, yeah.
Did you want me to ask all three at once, or should I ask one at a time? Which would you prefer?
We can just go the order that you had them out there. That'll be great as well.
Okay, so let's start with question number one. From
Sure.
your lived experience, Carrie, what do you most want people to understand about HIV criminalization that they may not have seen and they may not have read in terms of law or policy?
Yeah, what a great question. I'm got the opportunity to have that. When I read that, I was like, yeah, that is excellent. So I guess for me, what I most want people to understand is that when we read about the actual statutes, HIV criminalization laws, we're often see words like intentional or exposure, disclosure, penalty, oftentimes registry. But from a lived experience perspective, those words actually they're loaded, they're active, and they're very, very deceptive. I think they become the blueprint, if you will, to a social prison, if that makes sense. They create like oftentimes the prisons have razor wire across that keeps folks in. Why I think that these statutes create an invisible razor wire and that keep people from care, keeps them from safety, keeps them from dignity, and sometimes their own future. I think the first thing that policy hides is what I call like a knowledge trap. In
Mhm.
public health, I think that the goal it should be that you get tested, you know your status, you see your doctor, you get on treatment. And I think that's really, really simple and clear. But under the HIV criminalization statutes, knowing your status is the very thing that creates the legal risk. And what I mean by that is the person who's doing the responsible thing is the person that's most vulnerable to being prosecuted. And I can even take the most out of there. That's the person who's going to be held accountable for doing the right thing. Yeah, and that's painful because in a functioning public health system, I think knowing your status is the doorway to care, is the doorway to treatment, your prevention, your community support, all the things that make you thrive. But criminalization, the same knowledge can become actual evidence. A medical test can start to feel like handcuffs,
Yeah.
and that's not public health. That's a trap. And you cannot. I think it's important for me that we realize we can't normalize health in a system that rewards ignorance. You know, we can't reward people for not doing the right thing, and that's what the current system does. And secondly, I think it's the language erases everything we know, science, especially like now, what's going on in this country, even across the world. It erases science. The laws often treat HIV as like we're still. I saw someone in the comments put something about the 80s. That's what this law does. It takes us back to the fear of the 80s and the 90s, and they don't reflect anything about the treatment, about prevention, about viral suppression, about what we know about you versus you. And so, to make it personal in my own case, I was undetectable. I used protection, yet the system chose to see me as a threat and a monster. So that I call that the state's allowing, they ignore what a doctor says in favor of a police station, is the way to put it.
Mhm. I that is something else. And this is a great segue to question number 2. And
Mm.
I hope you all are giving them some love in chat, please. You are sharing some very powerful things. And I hope you will allow us to use your exact words to share it further beyond this session too. So the second question is, how did being criminalized for HIV non-disclosure affect your life beyond the legal case itself, including your health, family, relations, employment, housing, or just your sense of safety?
Yeah, no doubt. I think that's important that once the label is placed on you, it doesn't go away. And the harm doesn't stay just inside the courtroom. It's not like a mini series on Netflix, you get sentenced and it's over. It carries on after that. And so being criminalized for non-disclosure affected every part of my life, like you said. The legal case was just only one part of the punishment. The prison sentence is another, the time you spend in prison is another part of that. But the public label, the stigma, the barriers that follow become more like a second sentence, if you will. You're sentenced again by that. And so I often think about HIV stigma, the bigger picture, as a kind of a social astigmatism. I just recently got my eyes checked. And, stigmatism, it blocks you from being able to see, blurs the vision, and narrows the focus. I think that HIV stigma is kind of like that. So it distorts how people see me or see people living with HIV. And when that HIV stigma is attached to criminalization, it distorts how becomes that distorts because it's even more powerful. I think people stop seeing the person. They stop seeing Carrie, the advocate, Carrie, the strategist, Carrie, the family member, Carrie, the person who's grown and contributed. They only see the diagnosis through the lens, the distorted lens of my criminal record. One of the biggest impacts for me was is like the death of my privacy. In today's world, a criminal case becomes like a permanent searchable record
Yeah.
or label. Long after the courtroom, the internet, you get on the internet, there's I call it like a digital cell, if you will, not like the concrete cell, but more of a digital cell. So every time, why that's important, every time an employer, a landlord, a church, or even someone that I just meet off the streets, they can look it up, and I kind of start to wonder, are they seeing me who I am, or are they seeing me who they looked up on the internet? That's stigma. That's criminalization. And it
So
also, go ahead.
no, you're going right in the area because we're talking about what happens to folks when they reenter.
You bet.
One of the
You bet.
things that's the global issue is being seen in the way you might envision people seeing you. But what other ways has your life been impacted since you have come back into community?
Yeah, no question.
And
I
what
think
did you
it's
need? I want to know, what did you need to get
Yeah, no
and
question.
you
That's
released?
great time to talk about that. I think that I was released in September 11th, 2023. Um, and I realized freedom is not only about walking out the gate, walking out of prison. Release is also about housing application or getting a background check or judgment. All those things are part of what it looks like when you're released from prison for the first time. So the penalty that was not only for me, that I served 15 years, the penalty was kind of like an architecture of exclusion that followed me home. I brought all that with me back into the community. And what I want people to understand when it comes to reentry is that HIV criminalization isn't simply when you walk out the prison, wipe your hands and it's over. And I wonder sometimes if we're preparing ourselves as a community to welcome those people back. We say we want them back, or we laying the foundation to help them when they do get out. Reentry is not just one moment; it's more of a or like it's more of like an event, is how I see it. It's a long, long process to rebuild your life. I think that while the system is trying, oftentimes it feels like the system's trying to pull me back, if you will. And so it's a steady process. And one of the things about I call it a second sentence although I was sentenced to 30 years in prison, I did 15 years, you know when you're going to leave and you're done. The second sentence, which is once a part of reentry, is when you don't really know when that's going to end or if that's going to end. And it's really hard to plan. I think part of that, where you asked the question, Vanessa, about what do you need? I think that I was able to do a lot of research on criminal justice and what I'm really passionate about what reentry looks like across the board. And one of the terms that's thrown around is normalization. And what the framework of that says that we want people that are inside to really mirror what it's going to look like when they get out. And so we're talking about things like stable housing, healthcare, work, education, all those things that come out. And folks that are inside, they really work hard at educating themselves or to learn a vocational tree or to build purpose, and prepare for the release. But what's crazy, once you're on the outside, the system reduced me right back to inmate 32621. You know, no matter all the effort that you put into it, when you get out, you're still seeing that in the same way. And it comes across medical as well. I think it's easy, like when you get out, you're going to go to a clinic and get started going. But remember, with HIV criminalization statutes, your medical history is actually evidence the prosecution can use. So it really damages the relationship you can possibly have with your doctor. How open do you want to be with your doctor if you're concerned that that can be subpoenaed and then used against you in a court of law? That's another way that HIV criminalization is so dangerous.
I want to thank you, Carrie, for your
Of course.
remarks. We're going to do two things. One, I did instruct you all who are listening to this brilliant man, and he gave us some nuggets. I love some of the phrasing you use, like
Hmm.
architecture of exclusion, or architect of exclusion. I love that one. And you also talked about building cells. And we're gonna come back to that when we have the discussion group. But I want
You
you
bet.
folks who have been listening, I hope you're writing down your comments and your questions, or at least put them in chat. We will come back to them, but we want you to hear the other presenters. But I've got to tell you, um, Carrie, when you started talking about cells and the fact that we built a cell around HIV from the very beginning of this epidemic. And then we've always had the cell around criminalization. That's been a stigma going way back, just like you talked to in your closing remarks.
Hmm.
And we talk about the specific cell of HIV criminalization. Then we talk about all those other structural factors, whether it be our race or our gender or our disability or ability. I mean, we've kind of just in our society have made ourselves so small.
One way I look at it is, and you even touched on those the bigger issues. It even affects our intimacy, our vulnerability, and our ability to disclose, and all those things could become legal liabilities. And it kind of teaches, if you're not really careful, it teaches you to question whether safety, love, and trust are really even fully yours to have. You get so hesitant about that. You know what I'm saying?
Right.
That you really start to question the things that really matter in life, if that really is something that you can connect with. And
Really.
that's the danger. And I don't want to leave it that to such a gloom
No, no,
picture.
we're gonna leave with the
You know,
question. That's because we're coming back to you at the end.
yeah, there
So
are
the
definitely
question is,
there.
what is free?
Yeah, exactly.
What's freedom?
What
What's
exactly.
liberation? What
And
do
I
we
think
really
that
mean by those words?
and I'm so glad that Tammy and Kamara are on the call on this as well, because they've heard me say oftentimes, and when you're talking about a cell, I phrase it this way: although I was released, all that really changed is where I lay my head at night. All that other structural stuff is still there. And there's some barriers, there's some great work, and I don't want it to seem like it's a that we haven't done great improvement, because we have. And there are opportunities or organizations that work hard to rectify some of the damage that's being done. But I think in order to do that, we also have to recognize that it's there.
Absolutely. And thank you. There's such richness there. And so thank you.
Of
Thank you, Karen.
course, of course.
We're gonna put the next prompt into the chat so that while we're getting Nathan ready to do his presentation, and I hope I have the pronouns right because I didn't ask you. Paste. Okay. You all, here is your next question while we're setting Nathan up. Where do you see criminalization showing up in public health, healthcare, or social service systems? That's the prompt, y'all. Now we're going to bring you up, Nathan. Carrie, thank you once again. We are now going to hear from Nathan. Nathan, I want you to say your full name because I do not want to mess it up, and introduce yourself. But what I will say this is that Nathan is from the Williams Institute, and they have documented how HIV criminalization laws affect people living with HIV and how enforcement burdens Black communities. After he does his presentation, if we have questions or comments, we will save those towards the end as well. And we will come back to you, Nathan. I might do a clarifying question or statement before we move on to Kamaria. But right now, the floor is yours, Nathan. Please introduce yourself fully. Thank you.
I'd be happy to. Thank you for that introduction. My name is Nathan Cisneros. I'm the HIV Criminalization Project Director at the Williams Institute. Vanessa, you got my pronouns correct. I use he, him pronouns, but I'm happy to respond to anything that people feel comfortable using in this wonderful conversation today. Vanessa, I thought you set up a very powerful introduction for all of us. What a lead to for the entire conversation, and talking about public health, turning public health into a punishment issue. Carrie talking about stigma as a form of astigmatism and inability to see things and people clearly. What I'd like to do now is step back a little bit and talk about what we know about these HIV criminal laws in the United States. So if we could bring my slideshow forward, then I'm still in school, unfortunately. I'm at UCLA, so I'm used to giving little presentations. And I want to talk about what we know about HIV criminalization in the United States. If you can go to the next slide, please. So, as I mentioned, I'm at the Williams Institute. The Williams Institute was founded on the idea that facts matter, that data should inform law and policy, not myth or stereotype. And specifically, we want to make sure that facts, not stereotypes, inform law, policy, judicial decisions that affect sexual and gender minorities. Next slide, please. So here's a brief roadmap of where I'd like to go. I want to talk a little bit about the history of HIV criminalization in the United States, and then talk about what we know about who's most affected by HIV criminalization. Next slide, please. And then the slide after that, thank you. And just to do a little bit of definition setting here, we'll hear from Jada Hicks, our colleague at the Center for HIV Law and Policy, a little bit later. And they have actually, I think, a better, more expansive definition for HIV criminalization. But for now, why don't we use this as a definition? So HIV criminalization is laws that make otherwise legal conduct illegal based on somebody's HIV status, or that create harsher penalties based on somebody's HIV status. So, for example, if I know my HIV status and I don't disclose it to an intimate partner, that might be legal. If I know my status is negative, if I know my status is positive and I don't disclose, then I might be liable for a felony. Again, exact same fact pattern, except a person's HIV status. Sometimes we also see penalty enhancements. So spitting and biting, for example, might be a misdemeanor or a low-level felony. If I know my HIV status and I engage in that same behavior, then it might become a more harsh penalty. Again, the exact same situation, except for a person's knowledge of their HIV positive status. Next slide, please. Oh. So I want to talk a little bit about the history of these HIV criminal laws, and I'm glad that we talked so much about stigma at the beginning. Unfortunately, that's going to be a common theme both in the history of HIV criminalization and in the enforcement of these laws today. Most of these HIV criminal laws were enacted at the height of the AIDS crisis. We actually, by the mid-80s, knew pretty well how HIV is and is not transmitted, although maybe it took longer for that knowledge to seep out to policymakers. Most of the laws were, however, enacted before we had effective medications to both treat and prevent HIV. And when we look at the legislative record, we see that many of these laws were motivated by explicit fear. That fear was also often racialized. There was also a lot of homophobia. And in fact, the original Ryan White CARE Act tied federal funding of HIV services to the states to the enactment of these criminal exposure laws. Next slide, please. I won't belabor the point. These are some headlines from the era. I wish I could say that the headlines get much better the closer to the present that we come. I think things have gotten a little bit better, hopefully, than what you see here. But I do think that it's important to keep stigma within view as we're talking about HIV criminalization. And I'll actually come back to this point at the end of my brief remarks. Next slide, please. So this is a plot that shows the year in which states first enacted their HIV criminal laws, and that red line just shows basically where the Ryan White CARE Act is. And you can see some states like Florida are listed more than once. That's because states will sometimes go back and pass additional HIV criminal laws. But you can see, both before and after the Ryan White CARE Act, states were criminalizing people living with HIV. And unfortunately, you could see even to 2011, which is about the time that this paper did its data collection, there was a state that added an HIV criminal law. As late as 2022 in Pennsylvania, for example, there were new ways in which people living with HIV could be criminalized. This for communicable disease exposure in a spitting or biting context. Next slide, please. So I want to talk about what we know about HIV criminalization now, and if you could go to the next slide. So the Williams Institute has been looking at HIV criminalization for about 10 years now. We actually have passed the 10-year mark. And we've looked at state after state in which these laws exist. If you can go to the next slide, please. And I'll actually put this link in the chat here. These are states in which we have a report looking at that state's HIV criminal law. And you can see that sometimes we have more than one report in a state. That's because we've taken a different slice or looked at a different set of laws. But you can see we've looked at HIV criminalization from coast to coast now. Next slide, please. And what I want to do now is summarize some high-level findings. What do we know about HIV criminalization? Who's being affected? How are they being affected? So what I'd like to do is just briefly go through these bullet points and then show you what that looks like in data. The first point to make, though, is that most arrests and prosecutions are pursuant to laws that don't require actual transmission, the intent to transmit, or even substantial transmission risk. Many states criminalize conduct that could never transmit HIV. Most of these laws don't include mitigation strategies like barrier defense. They don't contemplate U equals U or PrEP. Many of these laws really are sort of time capsules in a way. What we know as well is that thousands of people have been criminalized because of their HIV status. What I'll present and what the Williams Institute reports always show are really like basement floor estimates of the number of people criminalized. And potentially the numbers are much, much higher. For example, we're never able to count the number of people criminalized under general criminal law. So that's things like bioterrorism, assault with a deadly weapon, attempted murder, which are all criminalization strategies that we've seen for people living with HIV. We see that enforcement continues to this day. This isn't a problem that went away in the 1980s and 90s. I mentioned briefly Pennsylvania. We had criminal cases up through 2025 last year when we requested the data. We know that certain groups of people, especially Black people, women, and sex workers, are disproportionately affected. I thought Vanessa's introduction was a brilliant framing for this entire conversation, that criminalization has been a means to control populations in the United States. And that, as a legacy of the United States, is as old as the country itself. Enforcement we see is geographically concentrated. That tells us that it's about policing or prosecutor practice. It's not about public health. And finally, as Carrie so eloquently described, you can have lifelong consequences because of contact with the criminal legal system. Next slide, please. So I'll just show really quick in some charts what I just described. So we just took the 5 most populous states basically for which we have a report, and we just counted the number of people criminalized just in those 5 reports. And just in those 5 alone, you get into the thousands. That's not all of the reports. Each of those reports is just a tiny slice of what's happening. And so you can imagine many, many thousands of people potentially have come into contact with the criminal legal system because of their HIV status. Next slide, please. This is a chart showing for Missouri. So Missouri is a state, unfortunately, like in Pennsylvania, where they added a law. And when they added a law, guess what? It gets used, especially when that's a law targeting interactions with law enforcement. And so you could see certainly HIV criminalization is not going down over time. And when you add a new law, potentially it can really explode in terms of enforcement. Next slide, please. Unfortunately, especially Black Americans are much more likely to be criminalized because of their HIV status. And we recently put out a brief, I've linked it in the chat, that tries to summarize our findings on the intersection of the HIV epidemic and the epidemic of mass incarceration and over-policing in the United States, both of which disproportionately affect Black Americans. So for example, in California, where I'm calling in from today, 6% of the state's population were Black or African American. 17% of people living with HIV in the state were Black when we published our report. About 40% of HIV-related convictions went to Black Californians. So you can see really disproportionate effects by race ethnicity. That's not the case everywhere, but it's the case in most places. And as I say, HIV criminalization sits at the intersection of these two epidemics in the United States that disproportionately affect Black Americans. Next slide, please. We know that a lot of this has to do with policing or prosecutorial practice and really has nothing to do with public health. We looked, for example, at what was called aggravated prostitution in Tennessee. We saw that overwhelmingly these arrests that resulted in convictions and mandatory sex offender registration happened in the context of the police vice squad sting operation. So the allegation was that an undercover police officer talked to someone they suspected of engaging in sex work about sex work. And then that was enough, again, for an arrest, a prosecution, conviction, and then mandatory sex offender registration. Overwhelmingly, these were Black women who were targeted in these sting operations. And we know also from other research, which will hopefully come out later this year, and also some published by a colleague, that many people targeted in these sting operations would identify as gender minorities, so either trans, non-binary, or gender expansive in some way. Next slide, please. Unfortunately, there was mandatory sex offender registration in Tennessee until recently. And in fact, because of the heroic advocacy efforts of people in the state and national partners on this call today, that has since been reformed. There's no longer mandatory lifetime sex offender registration, but that was the case for many years. And what we saw was that Black women, for example, were very unlikely to be on the sex offender registry, but if they were on the sex offender registry, it was very likely that they were there because of these HIV-related convictions. Next slide, please. And I just want to return to this final stigma point. So we also released a report recently looking specifically at HIV stigma, which I think is a sort of background hum throughout all of these conversations. What we saw is that HIV-related stigma is still pervasive in the United States, and at least over the last few years, it might have increased a little bit. So in a very commonly used social survey called the General Social Survey, we counted over 4 in 10 respondents, and this is a nationally representative survey in the United States. Over 4 in 10 respondents articulated at least some form of HIV-related stigma. And I can talk about the specific measures if you're interested, but there were these blame and these fear-based stigma measures. Sometimes people express both of them. HIV stigma is still, I don't need to remind people on this call, pervasive in the United States, and I think can be a real roadblock to especially HIV criminalization reform. Why don't I stop there? I apologize for the slideshow. I'd be happy to talk about anything specific.
No, that was excellent. And that dovetailed so nicely with Carrie's presentation because he gave the context.
Mm.
And so it was just I enjoyed I'm gonna say I enjoyed it even more so. Okay. I thought it was very good. I want to ask the audience now who's listening so intently, do you have a question of clarification or a question for where to get additional information from Nathan? He's going to stay with us. He's going to be part of the discussion, but I just want to make sure in case you're thinking about something that you could ask right now instead of waiting till later.
Yes. Hi, this is Denise Smith from Columbia, South Carolina.
Yes, go
I
ahead.
would like to know, will this information that you presented today, Nathan, be shared? Because one time me and you were supposed to have gotten together so that we can look at some statistics on South Carolina. So I'm still open for that as well.
I'd love to talk about South Carolina. Let me put you have my email address, but let me put it here for others as well. South Carolina is in our sights. We are interested in seeing what we can learn about criminalization in South Carolina. As I think you and I discussed briefly, it is definitely happening in South Carolina, and we have some data that can hopefully help advocates there.
Thank you very
Thank
much.
you. Thank you. Thank you for asking that question. Kathleen, is that how you say your name?
Yes.
Go ahead.
Thank you.
Kathleen.
I'm from Georgia, and in 22, we passed HIV modernization. And I'm just curious, when you use on your chart, you have figures regarding Georgia. And I'm wondering when those dates were on it.
Yeah, in Georgia, our first set of reports came out, I think, in 2018, and data went until the third quarter of 2017. So before the 2022 reform.
To report. Okay, that's what yeah, because I was, when I see that, I just get concerned as whether or not people know that we've passed that in the state.
Yes, and we actually went back to the state of Georgia recently and requested new data. So we have fresh data from the state of Georgia that will help us answer what was the effect of that 2022 reform. There were 2 reforms. One was changing this non-disclosure law, basically, and then this fluid exposure to law enforcement officers. That one got totally repealed. So we can see what happens when you change the elements of the crime and what happens when you do a full repeal. I have my email address here. I'd be happy to talk more about those results.
Because I
We're
would be
hoping to
really
release that.
Yeah, I would be really interested in that. We also got rid of hepatitis was also included, and we were able to eliminate hepatitis also.
Yeah.
I'm going to stop you there and just thank you for all the work that you all are doing. That is excellent. My goodness. And I'm sure we're going to hear some more about the work that you're doing. And Nathan, thank you for answering those questions when Kamaria and Tammy come up to talk about the work that Zero Project is doing. And so I'm without belaboring that point, I'm going to bring you up, Kamaria. Are you ready?
I'm ready.
That is excellent. We are so happy. I am so happy to have my colleagues here, and they are because I've known them outside of the work that we're doing right now, just as folks of the community. Kamaria, you are doing a fantastic job, you and Tammy.
Thank you.
Yes, it's just grown so much, and they're so very proud of you. And she's like, "Why are you acting like my mother? I won't anymore." Just
Was
want
it
to
on
say
my
y'all
face?
doing fantastic work. So we want you to talk about what you all are doing at Zero, what the priorities are in light of what we heard Carrie and Nathan talk about, and just where are we right now in the
Yeah,
land?
I really appreciate this opportunity and for like the way all this is laid out for this conversation, and look forward to like folks' thoughts and questions. At this point, I'll be reading my remarks and sharing links in the chat, so I won't be able to see anybody's communication. Um, but I'll answer things as I see them. So, Sarah, we recently, I'll just focus on this year. Uh, we're inspired by just watching different responses from state to state on a grassroots level to different policies and attacks that folks are facing. So we put out a poll asking people what were their community concerns around policies that are impacting their lives. And so we recently released our community policy priorities that are framed by the coalitions and partners we support and stand alongside with. And they have named and helped us work towards developing a strategic plan that's yet to be written that supports how our priorities are rooted in our survival, dignity, and movement building for people living with HIV and allies. And so the three like buckets of those priorities are all grounded in HIV criminalization, but also recognize the intersectionality that we must approach this work in. And so the first one is decriminalizing the care continuum, which is why the prompt you gave us before my first response was funding cuts. Like if we don't have the
Yeah.
resources that keep people in care, that's going to lead to criminalization, continued criminalization. And then under that is ending HIV criminalization and related punitive policies, which I know Jada is going to be talking about, so I don't want to steal any of her thunder. But that is one of our policy priorities that we lean heavily on our community partners to help inform us of what else is happening from a federal level that impacts the state levels. And the third one is addressing social and political determinants of health, such as housing, mental health, and healthcare access again. So they all like overlap on top of one another. And this was the best way we could summarize the variety of things we're hearing from people, but how can we as a national organization focus concisely and being responsive in those ways, and giving people best practices and strategies that they can model in their different coalitions and the outcome of their work. We know that we're not fighting only HIV criminalization laws themselves, but the broader systems that make criminalization possible. And in one of those, we partnered with, I'm going to get all the organizations wrong, but Center for HIV Law Policy, CHLP folks, and PWN. We are working together with others. I'm forgetting your names, and I apologize, around HIV Basic, which is highlighting the bodily autonomy, surveillance, informed consent is what BASIC stands for, around data privacy concerns. And so at Sarah, when we say, and I'm sure others, but when we say data privacy concerns, we recognize that they're grounded in the risk of public health surveillance systems that track already hyper-policed, hyper-criminalized, hyper-stigmatized communities without regard for our bodily autonomy or human rights. And we want to do I want to say do better because we're doing the best we can, but we want to dig deeper and not just addressing the issue from a national organization standpoint, but equipping coalitions and folks on a grassroots level of how to recognize when attacks to data privacy are becoming prevalent in their communities, and what does that look like, and how can they be responsive when they see it in the moment. I know for me as a woman living with HIV, it gets really it's a little sticky when you're in that appointment and you have to sign all this paperwork before you even go see your provider. And there have been several times I have been very frustrated because I drive an hour away and I'm not wanting to sign it, but I'm like, I don't have the gas to like to negotiate this right now. I can't just cause a scene. And so I know I'm not the only person that's going through that. And so I sign. There is a couple that I say I do not consent to this. That's my signature. I say I do not consent. And then I submit it. I have learned that people don't always read that. But it's in my record. So when it does become an issue, I can point to the date and time that I signed saying I do not consent and y'all still did XYZ. And so I can happily talk with folks offline about what that looks like. It's not the most comfortable situation, but that's one tactic that I participate in that I've learned from being at Sarah and being in community with folks and centering the lives and experiences of people living with HIV front and center. And then I'll close with this question around what are we doing is our work is focused on not just like legal reform. I know when I first started at Sarah, I kept hearing like reform, but I was like, the law shouldn't exist. Like we should be repealing, but also understanding that the systems don't make that easy. So we focus more on public education and building coalitions and leadership development through our programs like the AMP grant, micro grant opportunity, as well as SPJI, the Sarah Project Justice Institute. I believe we're going into our 5th cohort, I believe, of giving folks coalition building opportunities to develop their professional skills. So we're not just saying start a meeting and take notes and set up the Zoom, but also how do you build power in your coalition? How do you bring more people into the conversation? And ensuring that most people most directly impacted are at the center of shaping the solutions and not just being talked about after the harm has already occurred. Especially when it comes to criminalization, there's been a common pattern that we'll hear about something, we'll try to reach out to that person, and then they get brought into a coalition. And we try our best, but we understand how difficult it is that as you're building the coalition, if you're doing a revamp of your coalition, start looking for those folks from the onset so that they can help inform how that coalition is structured. And we know that that all takes relationship building and moving at the speed of trust.
And even if they want to assume leadership too.
Especially if they want to assume leadership, because you also want to make sure folks that are in any experience, like experiencing criminalization is a form of trauma, whether it's the threat of criminalization or actually being sentenced and serving time, that is a traumatic experience. And throwing somebody who's trying to process that experience into a leadership role without giving them the tools to navigate all of that and giving them grace while they do it and respecting their subject matter expertise. If that's not done with intention, it can create a very dysfunctional space of how to move policies and build relationships with legislators, because if they don't see that there is some sort of cohesiveness and unity within your coalition, they're not likely to take you seriously. So really being intentional about folks at the table and how you care for one another, especially now, is really, really critical.
And I just wanted you to comment, even though we said we would wait to the end, but there's one comment in there, I think that where you could say something right now, I think would be helpful to people, just informing them that this is not a quick and dirty process. As Wanda has said in chat, this is a very years-long process. Can you just speak to that, and how have you all conserved your energy? How have you kept going knowing this?
Yeah. Yeah. So I'll do a plug about HINAC because I think that's our saving grace to kind of help us keep our sanity. HIV is not a crime training academy. We intentionally have it for many reasons, but one of the reasons speaks to this point every other year. Because we want to celebrate the wins, big or small. And I don't think there's any such thing as a small win. A victory is a victory. I think that maintaining our stamina, staying in community and staying connected to the people who are experiencing things and making sure we don't get stuck in the silo of only being responsive to the laws or coalition building, but also being really intentional about folks who are experiencing criminalization. And you ask this question that we ask the Sarah all the time: what do you need? upon reentry? What do you need while you're in? What do you need while you're navigating the process of, are you going to be prosecuted or not? And so maintaining the stamina of staying in communication and not getting just stuck on one tactic. I think that's what will burn people out really, really fast, because you don't see the fruits of your labor if you're only focused on understanding the bill and the language and moving legislation, or if you only focus on the coalition building. My God, as a coalition coordinator, if I was only focused on that, I think I would have got burned out a long, long time ago. And so the longevity of this work is to not come into it thinking that you'll be able to fix things in 6 months to 2 years. Where you see that happening, there is absolutely some behind the scenes work happening before you saw the headline or before you saw the social media post. I can't even think of the quickest turnaround I've seen for coalition response to criminalization, but I know Tammy can speak about Iowa and how long it took for them to make their efforts. I'm in Florida, and we started in 2015. So we're going on a long time. I can't do math right now, but
No, we're good.
yeah.
You answered the question. So I just really wanted to get out there, because sometimes it's akin to what has happened to our own political system, that we think we fought fights that were fought long time ago, and we're back at it again. And so it just reminds me of how diligent we have to be in protecting our rights.
Can I
Yes.
just say one more thing to that?
Yes.
There was a change of White House administration some time ago. And before that, when we had what I kept hearing as a more friendly administration, I felt people being comfortable with that and didn't feel an urgency. And I hear people saying now, well, oh, once we get this one out of office, everything's not going to go back to normal, because what was normal before was still harmful. And we still have to keep fighting. And I think Carrie spoke to this. It's like, what are we building on the other side? It's exhausting, y'all. We're tired. I know we're tired, but we have to keep building for the other side of what we're looking for, and not get comfortable with status quo, especially with how systems are that we're used to. Like, oh, the election's going to come up. We'll have new leaders. We'll be fine. No, boo-boo, we won't. We got to keep fighting. We got to keep protecting our people. So I'll just leave that.
Absolutely. And thank you for saying that and clarifying that. No, it's lifelong. It's lifelong. That's
It
the
is.
It's lifelong. So I'm gonna move. Thank you so much for that, Kamari. As always, you always get some they're just so comforting nuggets. I call them comforting because you have a way of carrying yourself that lets people know it's gonna be okay. You can follow me because it's gonna be okay. I like that about you. So thank you. So Tammy, can you now talk about Zero from your perspective of where you're going and what you all will be doing in the future?
Excellent. Thank you. And thank you, Kamaria. And she is definitely the yin to my yang, and she's a chronic optimist. And then here comes your pessimist. Um, but grateful to work with her and Carrie every day. So I just wanted to touch on a little bit.
Oh, no, I know you were going to do that. I need you to introduce yourself.
Oh, I'm sorry, Vanessa. Hi, everyone. Tammy Hott, she, they, Sarah Project. I'm based out of Iowa. And as you were talking with Kamaria, I was doing math in my head, and I have been working on and discussing HIV criminalization, like involved since 2005. And oh my God, doing the math, that's 21 years ago. So talk about longevity. This is a long fight to get things changed.
Wow. Congratulations.
Thank you. So like Maria said, some of where Sarah's going, we are excited, and hopefully within the next couple of months, we will be announcing the next SPJI, Sarah Project Justice Institute, to, as she said, really help build leadership in state coalitions. We continue to work with over 19 different states in different levels of their strategy, and trying to modernize, reform, decriminalize, whichever word works best in that state. And as she says, this isn't an easy thing, but it's something that in Iowa, it took us 9 years to get the reform. It takes a while, and one of the things that, but it gives hope that you just have to continue that education. But also, it's not just education to legislators. In Iowa, we took a year to educate our own community, the HIV and the LGBT community, the ASOs, to make sure that everyone was speaking with one voice. I will admit, just my initial thoughts in 2005 when it was the first year that Iowans had gone to the Capitol. We had an ADAP waiting list. I was one of 108 people on there. So we went to the Capitol to get funding, and we were successful. Then after that, when we were doing our wrap up, the director of Chain said, "So what do we want to tackle next? How about the HIV criminalization law?" And I was like, in 2005, very naive, very uneducated about the laws. I was like, no, we need that. The law was titled The Intentional Transmission of HIV. And like I am sure many people who are not involved in the legal world or lawyers, hadn't read anything beyond that until I actually met, it was about 6 months later, Nick Rhodes. He had Nick had been criminalized in Iowa under our HIV criminalization law for non-disclosure. There was no intent, there was no transmission. It simply he could not prove disclosure. And so he was sentenced to 25 years in jail and a lifetime sex offender registry. He was able to get released early, and that's when our mutual nurse practitioner asked if we would meet. Nick's folks live about 7 miles from me, so we met, and I was like, "Wait a minute, you're not a bad person, and this law is BS." But had I not met Nick, I don't know if my mind would have been changed as quickly as it was. But seeing the harm that was caused to Nick, simply because he could not prove disclosure, really started my advocacy and HIV crim reform efforts. And and we continued on from there, and it's so important to have like survivors of criminalization like Carrie and Nick, and others, because unfortunately their experiences and their expertise in dealing with the criminal justice system does make a difference, and their stories changed hearts and minds. So when Sean created the HIV is Not a Crime documentary, and focus on the stories of Nick, Robert Suttle, and Monique Murray Howell Keat now, showing that documentary at any educational opportunity that we had, from different town halls to even with legislators, hearing their stories and the impact that these laws had on them really changed hearts and minds faster than just talking about how legally unjust these laws are. So having survivors involved in our efforts is key to changing hearts and minds. But one of the things that we also have to remember is providing the opportunity for people to share their stories, but also at any given time, giving them the opportunity to not share their story, because it's re-traumatizing them every time they share their story again. It's can become trauma porn for some people. They want to hear all the details when all we really need to make sure that people know is just the impact that stays with them forever. Luckily, we were able to, in 2014, So like I said, we started discussing reforming our law in 2005. We got the reform in 2014 through a lot of education to the legislators every year. But it wasn't just education. Some people think, oh, you just aren't educating them enough. Our bill was heavily negotiated. So we also, advocates need to remember that we're also dealing with the political system, which is severely broken and sucks. But our bill was held hostage because it was introduced by our legislative champion, Matt McCoy, in the Senate. And the House Judiciary Chairman held our bill hostage until the Senate agreed to hear a bill that he wanted introduced. And so when people say, "Oh, you just haven't educated enough," yeah, we have. You just have. I said the stars, the moon, the sun, everything aligned perfectly in 2014. When legislators, or when in Iowa we were purple, they had to work together to get bills passed. And unfortunately, we have become so polarized that it's making our work even harder to get bills passed because they're not willing to work with each other. So I remember back in the day when legislators actually talked to one another and compromised. And I'm hoping that we can get there sooner than that in other states, but it is something that we are still struggling with. But like I said, having folks who have the experience is so important, but also not just necessarily people who have been criminalized. We have so many community members who have been threatened with prosecution and the harm that that can do to a person as well. I know in 2014 there were 7 people currently being investigated, but luckily for whatever reason the prosecutors were waiting to see what the legislature did. So it's the harm that can come from just having these laws on the books that impacts and can impact everyone living with HIV.
Tammy, I'm
So
going to stop
having
you.
people, yes,
Tammy, I'm going to, because you're at 214, you're at 2014, the year of our Lord 2014. We have 12 more years to go. We, we're
yes.
not going to be able to do that. So what we're going to do, I'm going to ask you one last question, and then we're going to move to Jada so she can have her time, and we have a little bit of time for talking. Of the years you've been there, because you're talking a significant period of time. What is the one thing that has impacted you the most? What was the one thing that where you're like, yeah, I get this. I'm gonna stick with this.
For me, thank you, Vanessa. It was meeting with Nick and then meeting Carrie and talking to LaShonda and the survivors of HIV criminalization have really fueled the it refuels you to continue the fight.
Mm-hmm.
Because as Kamaria says, this is long and it can take multiple years and to continue with this. But every time you meet somebody else who has been impacted by a law, it's like, this is the reason why we're fighting. Also, as she said, HINAC refuels you as this is why we continue with this work even 21 years later, because we're
Yeah.
not done and there's still so many people impacted that we need to continue to fight for.
I appreciate that. You give really a new meaning to lifelong because that's what it is.
Yeah.
You know, criminalization has been along a long time. So thank you for that. Thank you both, you and Kamaria, for talking about Zero and what you're doing. It sounds really exciting. And we're gonna people at the end come in and talk about how they can help Zero Project and the Williams Project, Williams Institute. And we know Carrie is with you all. So we have the 2 powerhouse organizations on stage. Our third one, last but not least, is the Center for HIV Law and Policy. And Jada Hicks, I can say that last name, can come up now and present on um, telling us what the legal and policy landscape is right now in the United States, like what some of the major legal and policy patterns are, what does modernization mean, and what resources are out there for advocates. Go ahead, Jada.
Thank you,
And take your
Vanessa.
time, please. We have time.
Okay. Good afternoon, everyone. So my name is Jada Hicks. I use she, her pronouns, and I'm with the Center for HIV Law and Policy. So I wanted to talk a little bit about some trends that we have been seeing the last few years. Especially under this administration, what I want to start off with is that one of the major legal and policy patterns that we should understand across the states really is that HIV criminalization, really health status criminalization, it's not static. These laws really evolve alongside broader political trends around punishment, surveillance, public health, and social control. So we're not seeing a simple continuation of older criminalization frameworks, but we're really in a time now where we're seeing many places try the expansion of carceral and punitive responses to health conditions, to poverty, to drug use, sexuality, immigration, and bodily autonomy as a whole. So at the federal and state levels, we've seen this growing willingness to really respond to these complex social and health issues through criminal legal approaches or criminal law, rather than addressing the underlying structural conditions that really shape HIV risk and health outcomes. And this includes not addressing, housing instability, healthcare access, harm reduction services, and broader community support systems. So HIV criminalization exists within that broader framework. And so we've seen a little bit of our movement being on the defense. An example of this is the increased or the attempted increase of criminalization to STIs throughout the states. And one of the examples of this is actually a few years ago from House Bill 76 in Louisiana. So that was actually a bill where they attempted to make it a felony, to knowingly expose another person to an incurable STI. And they went back and forth between sex offender registration, lifelong registration versus lifelong ankle monitoring. Really just trying to do anything that they could to not only violate constitutional rights, but make sure that they were surveilling people living with STIs. And it's not like these laws don't already exist as well, right? Like in New York, Public Health Law 2307 makes it a criminal offense for anyone living with a venereal disease to have sex. And so this isn't a new strategy, but I really wanted to, or a new trend or pattern either, but I really want to highlight that I think we've seen kind of this uptick in these carceral approaches on top of executive orders that are really pointing states to take these carceral approaches as well and outlining why they should do that and how to do that. So wanted to name that at the top as something that I think is a trend that we're seeing. I also want to point out, though, that we're seeing a growing trend of cross-movement and cross-issue coalition building. And actually, our work at CHLP, I think with Team Attack is a great example of this. Team Attack is the ADA to attack criminalization. And Team Attack really recognizes that HIV criminalization intersects with disability justice and that the Americans with Disability Act can provide another framework for challenging discriminatory treatment of people living with HIV. And I think that that type of project really reflects a broader trend that we're seeing in advocacy right now, which is to really move out of HIV criminalization being a siloed issue and intentional focus on movement building and cross-issue building. So wanted to name that as another growing trend. I think something that we continue to see, unfortunately, is a pattern of inconsistent, either inconsistent participation or the complete exclusion of certain marginalized communities from the HIV decriminalization space and advocacy movements. Particularly, I'm thinking of like sex workers and people who use drugs. And so even when laws are modernized or repeal, a lot of times these particular groups are left behind, both in the framing of the problem and in the solutions being advanced. So HIV criminalization has always been deeply entangled with the criminalization of sex work, with the criminalization of people who use drugs, and yet reforms aren't always frequently structured in ways that treat these as intertwined and interconnected systems of control. But I will say also, and this phone call made me really happy hearing some of my colleagues on the phone. I feel like you really brought home my last point on this particular part of the question, which is really that I think we're seeing a lot of advocates shift from like purely reform-oriented approaches to really looking at the structural analysis of criminalization. I literally in my head was like, yes, when I was hearing other folks talk, because I can see actually their analysis, how it has shifted just in the few years that I've known them and that I've been in this work, to really looking at more of those structural interventions. And I think earlier advocacy really tended to only focus on narrowing or updating laws. Vanessa, to your point about modernization, so in the HIV context, when we talk about modernization, we're often talking about reform. And the word modernization a lot of times is more politically palatable to legislators. It really, to them, suggests like updating the law, right? Rather than us like fundamentally questioning criminalization. And so it sometimes makes it an easier conversation, depending on the audience, to frame it as modernization. But typically we're referring to that as some sort of reform where you're trying to align the law with current scientific understandings of HIV transmission and treatment. As Nathan said, many of these laws were written in the 80s and 90s. Depending on when they were written, there was limited medical understanding, but during all of that period, there was a combination of both fear and stigma. And so as a result, many of these statutes criminalize conduct that carries no possibility of transmission or little possibility or negligible risk of transmission. And people are punished regardless of whether there is an intent, if there of a risk of transmission actually exists, or of harm even. And so modernization often focuses on incorporating what we now know about the realities of HIV transmission into the law. So that can include things like requiring proof of intent to transmit HIV, requiring conduct that carries a significant likelihood or a substantial likelihood of transmission, requiring transmission, removing HIV-specific sentence enhancements. Kathleen mentioned that earlier, one of the attendees, like what happened in Georgia, and also fully repealing HIV criminal statutes altogether. I want to be clear and specifically name that repeal is also technically a form of modernization. And so sometimes people talk about modernization as only a means for narrowing or amending a law. But for many advocates, the most scientifically accurate or least harmful modernization truly is one that eliminates an HIV-specific offense altogether and does not criminalize someone based on their health status. And I also want to note that modernization can extend beyond criminal statutes themselves or beyond the criminal code. So what do I mean by that? It can look like expanding PrEP access. I guess that should have been another trend that I named, actually. We've seen a lot more focus on PrEP access and increasing PrEP access as well. I think that is a great and holistic approach to HIV decriminalization, is also looking at where we can amp up PrEP access as well. And so testing, treatment, and public health interventions that support people can also be framed as modernization. But it's best to think of modernization really as a harm reduction strategy. So you're attempting to reduce like the immediate harms of these laws in our communities, but also create conversations, broader conversations about decriminalization. And I think I saw Dorian in the chat like talking about avoid incremental change. We know that that sometimes isn't always realistic, but of course, the goal is we would like these laws to not exist at all.
Absolutely. And I'm going to stop you there. Jada, I love that discussion around modernization. I hope you all will do like a one-page fact sheet on that, because I thought that was great, because that helps expand the discussion beyond HIV criminalization. So want to thank you for sharing that rich nugget and all the history around the Center for HIV Law and Policy. I remember when Sean and I were younger, 20 years younger, and they had the International AIDS Society did a joint commission on HIV criminalization, and Congresswoman Barbara Lee was the chairperson at that moment in time. So a lot of work has been done since then. You all are evidence proof of it. And so now we're going to go into take one or two questions. I'm going to lead the question and comments, but if you all who have been participating would like to ask a question or a comment, at least put it in the chat so that if we can get to it later, no, we will get to it later. We'll ask whoever the question is directed to for them to respond, and we'll get the full question and answer back to everybody as soon as Mark and I can. But I want to go back to what Carrie was saying, because it kind of brings it full circle. What Carrie and Nathan was saying in relationship to how the work is being done by the three organizations, the Williams Institute, the Zero Project, and the Center for HIV Law and Policy. I want to ask you two first. Have you two thought about getting together? I think what would make the presentation so much richer is if you two got together and cut and paste Carrie's story around the Williams Institute, um, just the history of criminalization in this country. Have you all thought about that? Actually, I think I need to bring the two co-directors into this too. Oh, I'm so sorry, Carrie, to put you on the spot without asking the big chiefs if it's okay. Is Kalari is shaking her head. Well, I think the where we're going with this multimedia thing, where you're hearing a person's story and then you're actually can click on to what that person may be talking to. That might be something you two, or maybe even the three of you that are on here, think about doing. What do you all think?
Carrie, your face.
Yeah, come on, Carrie. You're gonna be a star,
Well,
Carrie.
I'm selfish as all get out. The opportunity to work with Nathan in any capacity, and of course with Jada, just where do I sign up? And I
That's
think
what I'm
that
saying. All,
and I think
all,
one thing
all
that
of you.
yeah, one thing I was with Sarah, we have a podcast that will bring the more human touch to it called The Mic Is Ours as well. And we also put out a magazine, Turn It Up, which focuses on these issues. But all means, the more people we get involved in that to get the message out
I
at a
think,
different
I think,
context would be
I
great.
think Nathan would be great for the history, and Jada for just what it means today to be doing
I'll
this
just
work. Go ahead.
also
Yeah.
say, we haven't started the actual process yet, but HINAC is coming up.
Oh yeah, I
Abstract.
forgot. I'm taking all the thunder.
Oh,
Oh,
no, you're
geez.
not. Call for abstracts will be open. That is a beautiful, I love that idea. I think that would be a
Yeah.
really amazing workshop. I know there's also, I think abstracts are still open for USCHA. I have a draft, but mhm,
Yeah,
reasons I don't
I'm
even know, I
saying.
don't even know if I'm going, but so yeah, I mean, there's opportunities to platform that, and I really appreciate you uplifting that. I don't think that we've had that conversation before of
Yeah.
overlapping that specific conversation. I know I am obsessed with the former ED at SAC when Dafina used to have maps,
Yeah.
historical maps. She overlapped them right before COVID, and you just kept seeing that everything was concentrated in the South. And I
Yeah.
was like, why is this the first time I'm actually visualizing? I know this, but why is this the first time I'm seeing this? And I've always been curious. And Carrie and I've had conversations about this. How do we talk about the care continuum and the HIV or the criminalization continuum, and not just around HIV, but health? So I love that idea. I don't know
Great.
who's going to start writing stuff, but I love it.
I hear you. And Jade, I hope that as you're hearing about these sexually transmitted disease laws, that you're all are developing your map, because those maps, Kamari she's so spot on about that. I think those maps help set the whole advocacy movement up, just so people, the visuals is important. Wanda, go ahead, Wanda. And then Dora,
Yes.
you. I'm going to call you next. Go ahead.
Okay, very quickly, USBHA, the deadline for abstracts and for
It's okay.
scholarships. They're not calling them scholarships anymore. But anyway, it's the 31st. So that I think that's Monday or Sunday. So hurry, hurry, hurry.
Thank you. Thank you. Dorian, this is a question for all of you. The question is about incremental versus change. What do we mean by change, and what can we live with? Let's do an abstract question, because I think you all given us a lot of rich information on criminalization, but where our community tends to bump heads is how fast do we move, or can we move fast at all? So Jade, I'm going to talk to you first, then Nathan, then Carrie, and then our Kamaria and Tammy. What do you think about this? Well, let me ask, do you want to add anything else, Dorian? Did I say it right? Did I represent your question right? Okay.
Yeah, I mean, in this time of, well, we need to make slow change because the processes are slow. We have just seen the Supreme Court move fast. We have seen states change laws, take away rights, and just completely diminish us. So why keep going on about incremental change? That's all.
Thank you. I appreciate it. I wanted to hear your words. So thank you, Dorian. Appreciate you. Jada, real quickly, what do you think?
I definitely think it is easier to tear groups down than it is to pass, say, positive reforms, especially with such an ill-informed group of legislators that really hold on to those stigmatizing views. I think what is missing from part of this conversation is they don't want to help people living with
Right.
HIV. They actually want to criminalize our communities. They want to see us in jail. They want to see us dying
Prematurely
because we
die?
don't have access
Yeah.
to care and treatment. So I think the difference is that what is happening and what HIV criminalization is being used to do is what they want. It is accomplishing its goals. And so they do not want to change that. Whereas what we're seeing with them passing horrid laws in less than a month, again, they want to harm our communities and they want to keep us in shackles, and they want to see our communities really obliterated in a lot of different ways. And so I think that that is a little bit of nuance that is maybe missing from that question.
Yeah, it's missing from polite society. Thank you very much.
Hey, V, Sanjay has been waiting with a question.
Yeah, I know we only have 3 minutes, and I got, oh my goodness. Yeah, go ahead, Mark. Go ahead.
Oh, Sanjay, did you want to jump in?
Yes, I'm sorry, y'all. So
No,
hello
don't be
everyone.
sorry. Go ahead.
I'm Sanjay from Little Rock, Arkansas, and I just wanted to mention, because I just started this process last week because I didn't know anything about it until someone referred me to. It's basically a petition, of course, here in my state of Arkansas, where I was criminalized. That I did a petition. I started a petition to order to have my case sealed from being criminalized. So, of course, for those who are familiar with my story, case started in 2017, ended in 2019, where no jail time. I just had to do 5 years probation, pay the fees, and thankfully, I did not have to register as a sex offender um, due to the charge. But with that charge, it's tricky because the original charge for knowingly, and that's what it's named, knowingly for exposing others to HIV, they decided not to prosecute. But they left me with, I had to plead no contest to aggravated assault. So that was the official charge. So I had to do 2 forms of petition, where I had to, of course, do the petition to order for the aggravated assault. And I had to do another form where they decided not to prosecute, to do a form for that and get that notarized, since it was categorized as non-prosecute. So that's something that, of course, I never knew about until literally last week, and I went on Friday to fill those forms out. So that's the process I'm doing right now, and hopefully, won't be no, I'll say,
Sanjay,
backlash. So that's
Sanjay.
about it.
Yeah, no, I am so sorry that we were not able to get you in and really give you the time that you deserve. Is there one of the organizations, have you been in touch with the organizations that are represented here on this on during this webinar session?
Well, actually, yes, I'm on the board for the Zero project.
Oh, excellent.
Um, yeah, so yes, ma'am.
Yes. And I'm going to ask you if you could stay on a few minutes after we end, okay? If you would do that.
Okay. Yes,
for us.
ma'am.
All right, great. We are at a minute before 3:30, and we were getting into a discussion about incremental change versus moving at the speed of light. And as we can see from Sanjay, that some people's lives is incremental, that we're going to be taking small steps until we're able to move, as Jada said, with purpose. When the country is ready to move with purpose, it will move. I want to thank Nathan, Kamaria, Tammy, Jada, Carrie. I'm going to give you the last word. Everybody stay on for just 30 seconds more. Say the word, my brother. What are you leaving us with?
I'm just first of all, it's a powerful group, even not just the speakers, but also everyone that was in attendance. Good to hear from you, Dorian. And the only thing I would say into it this, that if doing 15 years of a 30-year sentence taught me is that it does take long. It is the journey. Got to have the stamina to do it. And to piggyback off what Jada said just perfectly, the desire has to be there in order for things to change. I think that this is part of it. I think every time we get together in community, I leave a little bit stronger. So yeah, thanks for everyone who made a comments. Good to hear from you, Dorian, as always. I miss you. And I hope to see everybody sometime soon.
You sure will. And Mark, come on and say what we got to say. Thank you, everybody, for attending. Let's have a part 2 so we could have that rich discussion. Promise you, we're gonna have a webinar where only
That's
5-minute
it.
presentations and 90 minutes discussion. Okay. Thank you all. Thank you all.
Thank you all.